Almost 2 years into the novel coronavirus pandemic, the Singapore government has moved from a pandemic to an endemic phase of managing the COVID-19 virus. Among the key reasons is the Delta variant. It is more contagious than the Alpha variant, primarily among unvaccinated people. Singapore will start its vaccine booster program on September 14 for vulnerable groups like the elderly and immunocompromised. The city-state has one of the highest vaccination rates globally, where 4 out of 5 people are fully inoculated. Transiting to an endemic phase hopes to ease the strain on hospitals. The key is not to pick up every asymptomatic case. Instead, the Ministry of Health will look out for those who will get ill, monitor those who will get complications, and hospitalize them properly. It will also expand a pilot to let more vaccinated people recover at home, and cut local quarantine from 14 days to 10 days, starting next week. Singapore confirmed 555 new locally transmitted COVID-19 infection cases on September 11. The Ministry of Health said that bringing the total tally to 71,167.
It's a new normal framed by the multi-ministry task force. And while our lives won't go back to the way it was before the pandemic, it's the closest we can get, at least for the next few years.
The point is we're not trying to stop transmission anymore. We're not introducing major inconveniences to stop transmission. We accept it will transmit. We're protected by vaccination.
The key is not to pick up every asymptomatic case. What we're looking for is those who are going to get ill, those who are going to get complications, and we hospitalize them promptly and make sure they're monitored closely.
That means we can meet up with more friends and loved ones. The workplace will be more lively, and events with large crowds can resume. But as for when we'll reach this stage, it all hinges on vaccination rates.
We're not actually waiting for anything else. And we know once the vaccine is implemented, then COVID's a mild disease. The target is everybody, but I think once we get to 80%, that's very close. What month? I'm not sure what that is, but I'd say it's around the end of the year.
Currently, around 40% of the Singapore population has received both doses of an mRNA vaccine.
Quick on the heels of Singapore is its neighbor Malaysia. Speaking at the press conference, the Malaysia health minister said, with the Delta variant, scientists worldwide believed that achieving herd immunity would not be easy. Putrajaya accepts the COVID-19 virus as endemic, and will begin the transition by the end of October, when a higher vaccinations rate are achieved. According to its Health Director General, Malaysia confirmed 19,550 newly transmitted COVID-19 infection cases on September 11. The Ministry of Health said that brings the total to 1.98 million. 592 deaths were recorded, including 88 who were dead on arrival at the hospitals, or brought in dead. This brings Malaysia's death tally to over 20,000 deaths at 20,419.
The daily COVID-19 cases in Malaysia over the past 24 hours saw a slight dip, with 19,550 infections recorded as of noon today. Yesterday, the country recorded 21,176 infections. Sharing the latest coronavirus figures on his social media, Health Director General Tan Sri Dr. Nohisham Abdullah said the total cases in Malaysia now stood at 1,960,500.
Meanwhile, Malaysia Ministry of Science, Technology and Innovation has launched a new build of the MySejahtera application. It features a new checkout button, vaccination status, and the user's risk level on a single display.